Using a foam roll, we can access our lumbar spine and Quadratus Lumborum. Quadratus Lumborum is often known as the hip hiker. It's a muscle along the lumbar spine. You have one on either side. It attaches to the iliac crest, which is like the top of your hips and the back, that bone there. And then it attaches to your lower ribs. When the right Quadratus Lumborum contracts, it hikes the hip, thus the name, the hip hiker. As I decide to work on this, I'm gonna find the center of the foam roll. I'm gonna put it in my lumbar spine and slowly bring myself up. Your floater ribs are there, so you wanna be a little gentle. As I'm right here, I'm a little bit on center. I'm not leaning to one side. I'm just finding my position so I can press. I'm right in between the gap above the iliac crest and below the ribs. I'm gonna roll just a little, right there to the right, just to give myself a little bit of pressure. If it's too much, I just back off. Right there. Much body weight just pressing down into the QL. I feel it down my right leg just a little bit. You can always switch sides. You just take your time and roll just a little to the left, just to give you a break on that right side. Not quite as tender over here. I'm going to change my position slightly. There we go. I don't want you to feel like you have to know exactly where the Quadratus Lumborum is or the QL. You're really just pressing on tissue. So long as stuff is intense and not painful, you're really good to go. Foam roll is a really great way to access this area.